it's clear that everyone's tired. The healthcare workforce is tired. People are tired. This is not easy, particularly doing things that are contrary to our human nature, which includes social distancing and not spending time with the people that are important to us. But we are in the middle of a relatively significant surge of patients. And now more than ever, we really need to double down on those simple measures that we know are going to make a difference. And you've heard them many times: wearing masks, staying physically distant from people, avoiding mass gatherings, washing our hands, and so forth. This is the time where we can do everything in our personal power to protect those that we love, protect community members, protect vulnerable populations. So even though we've been at this for a while, we need to keep at it. But we also need to recognize that the healthcare delivery system in the Albuquerque metro area and in New Mexico is prepared for this. We are continuing to cooperate extensively to make sure that patients are kept safe, that they have a place to receive care, that ongoing chronic health conditions can be managed. But we need everyone's help to continue to do so.
We've watched our behavior in the state, and we know when it gets like this, people do pay attention, and you see the case rate roll over and it start to come back down. And so that's what I believe will happen, because I think folks are listening and want to care for one another. If it continued at its current rate for a couple months, it would be catastrophic. There would be no beds in the hospitals. If you got in a car wreck, there'd be no place for you to go. If you need to deliver a baby, there may not be a bed in the hospital for you. I mean, it really, if it continued at this current velocity with no rollover, with no tempering back down and coming back down, it's hard to describe how catastrophic that is. Remember that this disease spreads very quickly, and it's not a linear curve, but it gets steeper and steeper. And so it's kind of a doubling idea, right? If you double 2, that's 4. If you double 2,000, that's 4,000, right? And then 8,000, and 16,000. And so once you get large numbers and you start doubling them in a week or so, it's just catastrophic. So I'm not sure if that's what you're looking for, but we cannot as a community allow that to happen. We really all have to get in this together. I think that people are going to start recognizing the risk if they have not, and we'll see people change their behaviors.
We have brought in a number of outside, or what we would call agency staff, to help support and bolster our workforce. So we've been doing that since March.
There's one really important caveat I want to put to this. If we continue the current trend we have in our state for another month, we will not have enough healthcare workers. There will not be enough hospital beds. If you look at the numbers and don't assume that we roll over on those numbers and come down, this will grow to a point where I don't think anyone can take care of them. So that's going back to what you said, Dr. Pitcher. We have to all pull together, and if we all pull together today, then we will all be okay. If we wait 2 weeks, 3 weeks, 4 weeks for any changes, we're not going to be okay, and there's not enough staff anywhere that will be able to get us out of that. So I think that's a really important thing.